Important message. Kidney disease is silently destroying millions of lives in the United States, United Kingdom, Canada, and Australia, often without any warning signs until it's too late. The food you eat has a direct impact on whether your kidneys survive or slowly shut down. These top 12 foods are not just healthy, they can literally save your kidneys and help prevent permanent damage. The first food that absolutely must be part of your diet if you're trying to save your kidneys is red bell peppers. They're low in potassium but high in vitamins like Ca, B6, and folic acid. Potassium is one of the most dangerous minerals for people dealing with chronic kidney disease, especially in the United States, where high potassium diets are heavily pushed without proper awareness of the consequences. What many people don't know is that once your kidneys start to decline, they lose the ability to filter out excess potassium. This leads to hyperkalemia, which can cause fatal heart rhythms. Red bell peppers offer a crisp, sweet crunch while helping you avoid potassium overload. They're also loaded with antioxidants that reduce inflammation, which is a core driver of kidney damage in people with diabetes, high blood pressure, and autoimmune conditions. People in Canada and the United Kingdom often overlook how inflammation silently erodes kidney tissues. Red bell peppers directly fight that through lycopene and beta-carotene, natural plant compounds with kidney protective properties. Whether raw, grilled, or blended into a smoothie, this food should never be skipped by anyone trying to protect their kidney health. Second on the list is cauliflower, a powerful, kidney-friendly food that acts almost like a sponge, helping to soak up toxins and reduce the workload on your kidneys. This vegetable is naturally low in potassium, phosphorus, and sodium, all three of which can stress out failing kidneys. In U.S. hospitals, nephrologists frequently recommend cauliflower for dialysis patients, not just because it's safe, but because it supports detoxification in the liver, helping the kidneys do less. It contains compounds like glucosinolates and indoles that assist in neutralizing toxins, something most people in Australia and Canada never hear about unless they are already deep into kidney disease. If you're someone who eats a lot of processed foods, which is very common in the United States, then your kidneys are under constant assault from phosphates and sodium preservatives. Cauliflower helps reduce the internal toxicity by providing fiber and antioxidants. Plus, its high vitamin C content helps reduce inflammation and supports immune function, which becomes crucial for anyone with declining kidney function. Next comes blueberries, and it's impossible to stress enough how important this fruit is. Blueberries are practically a superweapon against kidney decline. They're extremely high in anthocyanins, a type of antioxidant that protects against oxidative stress and free radical damage, which are two of the main killers of kidney cells. In fact, studies from the United States National Kidney Foundation have shown that antioxidants from berries can help slow down glomerular sclerosis, a process where the filtering units of the kidneys begin to scar and fail. This condition is frighteningly common in people over 40 in the United Kingdom and Canada, yet rarely caught in time. Blueberries also help manage blood sugar levels, making them perfect for diabetics, who are the #1 group at risk for chronic kidney disease. Just a small handful of blueberries each day, whether fresh, frozen, or in a smoothie, can significantly lower inflammation markers and improve kidney filtration rate over time. Their natural sweetness also makes them a better option compared to artificial sweeteners, which many American and Australian consumers still use despite evidence they can worsen kidney function. The fourth food that protects the kidneys with surgical precision is garlic. Now, people don't often think about garlic as a kidney-saving food, but they absolutely should. Garlic reduces inflammation, lowers cholesterol, and most importantly, reduces high blood pressure, one of the main causes of kidney failure in the United States. Americans consume too much sodium and processed fats, causing arteries to harden, which directly raises blood pressure. That pressure damages the tiny blood vessels in the kidneys, reducing their ability to filter waste. Garlic, through its sulfur compounds like allicin, helps dilate blood vessels, reduce arterial plaque, and ease the kidney burden by improving circulation. In people from Australia and the United Kingdom who consume more natural, whole foods, kidney disease rates are slightly lower but still far from ideal. Garlic can also act as a natural antibiotic and reduce bacterial load in people with frequent urinary tract infections, a common trigger for kidney infections. Many people have no idea that recurrent UTIs can permanently damage kidney tissues and lead to scarring. Garlic fights this both by killing bacteria and enhancing immune function. The trick is to consume garlic raw or lightly cooked to preserve its active compounds. Another incredibly protective food for the kidneys is cabbage, which offers a powerful combination of phytochemicals and low potassium content. People with compromised kidneys often hear about what they can't eat, but cabbage is one of those rare foods that's not only safe, it's therapeutic. Cabbage contains sulforaphane and indole-3-carbinol, which are compounds that actively protect kidney tissues from damage caused by oxidative stress and uremic toxins. In Canada, where cold weather drives up processed food consumption during winter, cabbage can be a year-round, affordable staple that actually fights back against kidney inflammation. Uremic toxins, like indoxyl sulfate and p-cresol, build up in the bloodstream when kidneys can't filter properly, causing widespread damage to the heart, brain, and nerves. Cabbage helps clear those toxins through increased fiber intake and improved gut health, which plays a huge role in reducing kidney strain. It also helps with weight control, which matters deeply because obesity is now directly linked to kidney decline in United States research. The average American diet, loaded with refined carbs, red meats, and hidden salts, overworks the kidneys constantly. Cabbage helps to reverse some of that damage while also protecting blood vessels and controlling blood sugar. The sixth must-have food is egg whites, a high-quality source of protein that doesn't flood your body with phosphorus or saturated fats. In the United States, there's a dangerous trend of eating too much meat, especially red meat and processed meats like bacon and sausage, which are overloaded with sodium and nitrates. These compounds are nephrotoxic. They literally damage kidney cells and lead to proteinuria, where your kidneys start leaking protein into your urine. Egg whites, in contrast, provide pure protein with minimal byproducts that the kidneys have to deal with. This is incredibly important for people in the early to moderate stages of kidney disease, especially those not yet on dialysis. In Australia and Canada, some dietitians have started recommending egg whites to replace protein shakes or meats for people showing signs of kidney strain. They help maintain lean muscle mass without accelerating kidney decline, which is a delicate balance to maintain. Egg yolks, while nutritious, contain higher levels of phosphorus and cholesterol, which can be problematic. For people with elevated creatinine levels, a marker of poor kidney filtration, switching to egg whites can make a measurable difference in lab results within weeks. This is only 1/3 of the full list, but each of these 6 foods already has the power to shift the trajectory of your kidney health. When used correctly and consistently, they relieve the kidneys from chronic overwork, reduce inflammation, improve detox pathways, and support cardiovascular health, which is inseparably linked to kidney function. Millions of people in the United States, many completely unaware, are walking around with stage 2 or stage 3 kidney disease simply because they follow standard food habits that are deeply flawed. From fast food to oversalted snacks to excessive caffeine and sugary sodas, the modern diet is brutal on the kidneys. These 6 foods act like shields, providing nutrients the kidneys love and avoiding compounds that damage nephrons, the microscopic filters inside the kidneys. If you or someone you love is already struggling with blood pressure issues, high blood sugar, fatigue, swollen ankles, or foamy urine, these are early warnings of kidney damage, and these foods should become staples in your daily meals without delay. The 7th food that needs to be taken seriously if you're fighting to save your kidneys is cranberries, especially unsweetened or pure cranberry juice in controlled portions. Cranberries have powerful antibacterial properties that prevent bacteria like E. coli from sticking to the walls of the urinary tract. This is absolutely critical, especially for people who experience recurring urinary tract infections, which can ascend into the kidneys and cause irreversible scarring. In the United States, recurrent UTIs are one of the most overlooked triggers of kidney inflammation and kidney damage, particularly in older adults and diabetic women. A lot of people think they're just dealing with frequent bladder infections, when in reality, these infections could be gradually scarring their kidneys until they enter stage 3 or 4 chronic kidney disease. The proanthocyanidins in cranberries not only prevent bacterial attachment, they also have antioxidant and anti-inflammatory effects, helping the kidneys avoid oxidative stress. In the United Kingdom and Canada, kidney specialists have started using cranberries more actively as a dietary supplement to protect people at high risk for kidney damage from infections. But it's crucial to avoid cranberry cocktails loaded with sugar because excess fructose worsens insulin resistance and leads to fat deposits in the kidneys themselves. Stick with whole cranberries, dried, unsweetened, or fresh juice in small amounts. Next comes apples, one of the most kidney-friendly fruits out there. Apples are rich in pectin, a type of soluble fiber that helps reduce cholesterol, regulate blood sugar levels, and eliminate toxins through the digestive tract, lightening the load on the kidneys. Many people in the United States have no idea how toxic their blood becomes from processed food, synthetic additives, and poor digestion, all of which force the kidneys to work harder. When your gut can't eliminate waste properly, that burden falls on your kidneys. Apples help prevent this. They also contain anti-inflammatory compounds like quercetin and flavonoids, which protect the delicate blood vessels in the kidneys from damage. In Canada, where apple orchards are common and apples are readily available year-round, they're often used by dietitians as part of renal diets to keep potassium intake controlled while still providing valuable antioxidants. Apples are also very gentle on the stomach, making them perfect for people with nausea or reduced appetite due to kidney problems. If you've ever experienced metallic taste, poor appetite, or changes in your sense of taste, it could be your kidneys trying to warn you. Eating an apple a day could truly help the kidneys delay deterioration, especially when combined with other low-potassium, low-phosphorus foods. The 9th food that fights to protect your kidneys is onions, which are surprisingly powerful in managing kidney stress. Onions contain sulfur compounds, antioxidants like quercetin and chromium, a trace mineral that improves how your body handles insulin. Insulin resistance is one of the biggest culprits behind kidney failure in the United States, and the rising rates of prediabetes and diabetes are pushing millions of people into kidney disease without them even knowing it. Onions help by regulating blood sugar, lowering blood pressure, and reducing the load of toxins that enter your bloodstream through poorly metabolized food. In Australia and the United Kingdom, onions are part of nearly every savory dish, and their benefits go far beyond flavor. Onions help improve circulation, lower LDL cholesterol, and support immune health, all of which support long-term kidney preservation. Importantly, onions are low in potassium, which makes them a safe option for people with reduced kidney function. Cooked or raw, added to salads, soups, or stir-fries, onions deliver anti-inflammatory effects that slow down the progression of chronic kidney disease by improving vascular function around the kidneys. Many people don't realize that even small blood vessels feeding the kidneys can get clogged or damaged, causing filtration problems. Onions fight this hidden damage daily. Another essential food for kidney health is olive oil, especially extra virgin olive oil that's cold-pressed and unrefined. This oil is loaded with monounsaturated fats and anti-inflammatory compounds like oleocanthal, which have been shown to reduce inflammation markers in people with early-stage kidney disease. In the United States, where heavily processed seed oils are the norm, like soybean oil, corn oil, and canola oil, switching to olive oil could be life-changing for the kidneys. These other oils promote chronic inflammation and have been linked to faster kidney damage. Olive oil, on the other hand, supports heart health, stabilizes blood sugar, and protects kidney tissues from oxidative damage. For people dealing with hypertension, an epidemic in Canada, the UK, and the United States, olive oil helps to soften arteries, reducing pressure and preventing further destruction of glomeruli, the filtering units inside the kidneys. Even better, olive oil doesn't contain phosphorus or sodium, and it can be used safely for people on low-protein, low-sodium renal diets. It's ideal for drizzling over salads, roasted vegetables, or used lightly in cooking. For people with chronic fatigue, puffiness, or unexplained water retention, olive oil can help by improving vascular health and reducing systemic inflammation that contributes to fluid imbalance and kidney stress. The 11th food that protects your kidneys from both metabolic and inflammatory damage is strawberries. Strawberries are low in potassium, rich in antioxidants, and high in fiber. They also contain anthocyanins, ellagic acid, and vitamin C, all of which help prevent kidney, cell damage and promote tissue repair. In people with early kidney disease, strawberries can help combat the constant oxidative stress that attacks nephrons. In the United States, researchers have warned that oxidative stress, largely from poor diet and lifestyle, is responsible for the early breakdown of kidney filtration mechanisms even before symptoms arise. Strawberries directly neutralize free radicals in the blood, reduce inflammation, and help the body regulate blood pressure, all of which are critical for kidney preservation. In Canada and Australia, strawberries are often viewed simply as a fruit or dessert topping, but their medical benefits go far beyond that. When eaten regularly in their raw, unprocessed form, strawberries improve insulin sensitivity, help reduce cholesterol buildup, and support healthy blood vessels in the kidneys. Importantly, their sweet taste helps people transition off refined sugar and artificial sweeteners, both of which are toxic to the kidneys. For people with diabetes, prediabetes, or high blood pressure, strawberries offer natural sweetness without raising potassium, which makes them incredibly useful for long-term kidney health. The 12th and final food in this segment that you must not ignore if you care about your kidneys is fish rich in omega-3 fatty acids, like salmon, mackerel, or sardines. These fish have strong anti-inflammatory effects and can lower triglycerides, reduce blood pressure, and improve blood vessel function, protecting the kidneys from internal inflammation and cardiovascular strain. In the United States, omega-3 deficiency is incredibly common, and that deficiency contributes to metabolic syndrome, diabetes, and hypertension, all of which kill kidney function silently. High-quality fatty fish reduce C-reactive protein levels, an inflammatory marker that rises in people with kidney disease. In Australia, nephrologists often recommend fish oil or fatty fish to slow down progression of chronic kidney disease, especially in patients with autoimmune-related kidney problems, like lupus nephritis. These omega-3s work by stabilizing immune function and reducing the overproduction of immune complexes that can clog or inflame kidney structures. For people experiencing chronic fatigue, swelling, or foamy urine, a sign of protein leakage, these types of fish can help by repairing damaged endothelial cells and reducing filtration pressure. However, it's vital to choose wild-caught, low-mercury fish and avoid heavily salted or processed fish products, which are dangerous for kidneys. People in the United Kingdom and Canada often turn to smoked fish, but the high sodium content can completely reverse the benefits. Stick with fresh or grilled options with minimal seasoning to get the full protective effect. All 12 of these foods form a defensive wall around your kidneys, protecting them from the silent destruction caused by poor diet, chronic inflammation, toxic overload, and vascular damage. Whether you're in the early stages of kidney strain or already dealing with elevated creatinine, proteinuria, or hypertension, changing your diet immediately to include these foods could dramatically alter your kidney trajectory. Each bite is either helping or harming your filtration system. People in the United States and Australia, in particular, often don't realize that their symptoms, fatigue, bloating, insomnia, brain fog might not be just stress or aging, but early stage kidney dysfunction. Adding these foods creates a path back to health and allows the kidneys a chance to recover and regenerate before it's too late. Even if you've already been diagnosed with stage 2 or 3 kidney disease, or you're dealing with symptoms like foamy urine, persistent swelling in the feet or face, or high blood pressure that doesn't respond to medication, these 12 foods can significantly change your outcome, but only if they're used consistently and correctly. In the United States, many people are told by their doctors that once the kidneys start failing, there's no going back. But that is not entirely true. There is strong clinical evidence, including research published in American Journal of Kidney Diseases and studies supported by the National Institutes of Health, showing that lifestyle changes, especially dietary interventions, can slow, pause, and even reverse some types of kidney damage before dialysis becomes inevitable. And yet, across Canada, the United Kingdom, and Australia, most patients are given generalized advice like eat healthy or cut salt without any real direction. That kind of vague guidance is a major reason why so many people end up on dialysis machines without even understanding what went wrong. The kidneys are organs that take years to fail, and that also means they can respond incredibly well to long-term nutritional therapy. These foods work by targeting the main causes of kidney deterioration: inflammation, high blood pressure, poor blood sugar control, toxin buildup, and electrolyte imbalance. Red bell peppers, strawberries, and blueberries target inflammation and oxidation, protecting the nephron walls from scarring. Garlic, onions, and olive oil tackle high blood pressure by reducing vascular stress and plaque. Apples, cabbage, and cauliflower support digestion and toxin removal, decreasing the load on your kidneys every day. Cranberries fight bacterial infections, egg whites provide clean protein without phosphorus, and fatty fish rich in omega-3s protect your blood vessels and regulate your immune system. This multi-angle approach is absolutely necessary because kidney damage is not caused by one single thing. It's a combination of metabolic stress, immune dysregulation, poor diet, toxic exposure, and chronic diseases. That's exactly why the standard American diet is so dangerous. It delivers all the worst components at once: high sodium, high sugar, low fiber, inflammatory oils, and dangerous additives like phosphate preservatives that are absorbed at nearly 100% and never labeled clearly.